Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program features physicians and healthcare providers that bring information about services and programs available here at KRMC. I've got a great guest for my show today, so I hope you'll stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Melanie Bradle. She's a speech pathologist here at KRMC. Thanks for being on the show, Melanie.
Thank you for inviting me.
Well, you're brand new, both to Kingman and to KRMC, right?
Yes, I am.
So how new is brand new? When
brand new is less than 2 months.
Oh, wow. That is new.
Yes.
So you haven't experienced any of this yet?
No.
Harley weekend, summers, fun run. Oh, you got lots of good things coming for you.
I can't wait.
So where were you before Kingman?
I came from Cincinnati, Ohio.
Oh, very good. And were you a speech pathologist there?
Yes. And just to kind of clarify,
yes,
the title for my profession is speech language pathologist.
Oh, very good.
According to the American Speech Hearing Language Association.
Okay, very good.
So when you hear that, I wanted to bring that up because oftentimes you will hear speech pathologist, speech language pathologist, speech therapist. So
and
it all works.
They're all the same,
yes.
Just different names that they're calling you by.
The official title is speech language pathologist. Yes.
Very good.
And yes, I was.
Great. Now, where did you work in Cincinnati?
I worked at Drake Center, which was part of the University of Cincinnati Health System.
Oh, okay.
And I have been practicing speech language pathology for 20 plus years.
No. You're not that old.
Well, I started when I was 10.
Oh, okay.
No, not really.
Very good. Well, you don't look old enough to be practicing for that long, but.
Well, thank you. But yeah.
Well, very good. And were you in Cincinnati that whole time before?
I was. I was born in Cincinnati.
Oh my goodness.
And stayed in Cincinnati, and my family were all in Cincinnati, and things have changed over the years. So my husband and I said, Kingman Regional, that's a wonderful place. And
it is. I'm a little prejudiced, but
well,
it
I
is.
can see why. You have a beautiful facility and it's a beautiful town. So we thought this was an opportunity for us to change our geographic location, as well as I really thought Kingman was a place I could see myself.
Very good. I was going to say, because that's a big change.
It's a big change.
We do get snow, but not nearly like what you get in Ohio.
Exactly.
And I love it. I'm from Minnesota originally, so this is my idea of a perfect winter where it snows and then it melts.
Exactly.
It doesn't
That's
stand
what I would.
the ground for 9 months out of the year.
Yes.
You know.
Yeah.
Or you can drive up into the Wallapies and have a snowball fight and go sledding, build a snowman, and then come back down, and you're out of it. It's wonderful. So I
really
think you're going to like it.
I think so. Yeah.
Good, good. Now, what does your husband do?
Well, he is in insurance.
Oh, okay. So it's a little, has that flexibility for location as well then.
Uh-huh.
Okay,
Yeah.
very good.
So he's trying to decide what he's doing and where he's going to hang his hat.
Okay.
And, yeah.
Well, very good. Well, we're blessed to have you here. That's great.
Well,
because
thanks.
I don't know, I think we had a speech language pathologist a while back, but not recently. It's been a while.
That's my understanding, that, and I'm getting a lot of questions from my clients that the first question is, where are you from and are you a traveler?
Oh, yes.
And I say, no, I'm permanent, and they just are thrilled, and I am too.
Yeah, they are, because that is, I mean, I would think, and we'll talk more about exactly what a speech language pathologist does, but I would think part of that is building a relationship with your patients.
Absolutely.
So, so let's talk about speech language pathology. What does that mean?
Oh, I love it when you say that.
When I got it right.
No, you got it right. I just thought I was going to plug, for my profession, making sure this was a good opportunity.
Good.
So what do I do? Well, the speech language pathologist, of course, everyone thinks about when they were in school, the speech teacher that came in and worked on articulation and language, and that is a piece of what...
They did that to me.
Okay.
Yeah,
and it worked.
Do you think so?
I think so.
I've still been accused occasionally of having a speech impediment, but I think overall I'm pretty good.
I think you communicate pretty well.
Thank you.
So, you know, the speech language pathologist, of course, communication is a big aspect of what we do. And communication is sending a message and receiving a message. So using language, being able to formulate ideas and complete thoughts. Sometimes in the school setting, that's more of a grammatical English type of communication, versus when you're working with adults who have had strokes, they may have had damage to the brain in the areas that formulate language or ideas. And so the speech language pathologist is that global professional who can help with communication in any of those settings.
Oh, wow. That's a much bigger picture than, I guess I was thinking speech, that just helping people talk.
Yeah.
But that's
it's
a lot
also
more.
what you say.
Right.
So that is a big umbrella that we fall under, of course, and I think everybody would say, oh yeah, speech pathologist, speech language pathologist, yeah, communication, speech, language. But I think a couple of other misconceptions that people may not know about is we are also involved in swallowing. And so we are very knowledgeable, of course, in the head and neck anatomy. And so we are the key professionals to evaluate swallowing and to determine the safety of swallowing, because, again, patients may have changes from stroke. They may have changes due to head and neck cancer. They may have other issues that have changed their ability to swallow safely. So the speech language pathologist may see them in a hospital setting, in an outpatient setting, to help them evaluate what's happening physiologically, anatomically what's happening, and then how we might treat it or help that person to compensate to swallow as safely as they can.
Okay, so it's got to be that swallowing has to do with that opening and closing to make sure it goes down the right pipe.
Exactly, right.
My mama used to say.
Exactly,
Yeah.
and everyone says, you know, it went down the wrong pipe.
Right.
And there are two pipes. The pipe we want food and liquid to go into goes into the stomach, and the other pipe goes into our lungs.
Right,
and that's not so good.
They don't mix well.
No. And sometimes there are signs and symptoms that you can see, and sometimes patients who, a lot of times with stroke, there may not be a sign or symptom, but the person has medical complications because of it. So we're called in on those kinds of cases to help the physicians determine what is happening with the swallow. So the speech language pathologist is involved in swallowing, and you might hear the term dysphagia.
Oh, I have heard that before.
Okay.
I didn't really know for sure what it meant, but
That's
I've heard
what it means,
Okay.
disordered swallowing.
Okay.
And oftentimes the speech language pathologist may need to do further testing to help determine that anatomy or physiology of the swallow, because from the table side you can't tell what's happening oftentimes in the throat or where that food or liquid is going. So we have some instrumental tests that we use that are the standard for best practice. And so the speech language pathologist is the key person who works with radiology for modified barium swallows.
Oh, okay.
And then there's
So it's just-
another instrumentation that we use, which is called fiber optic endoscopy evaluation of swallowing.
Wow.
I know, speech language pathologists love long words. I'm sorry, everybody, but that's how it is.
But so do you do both inpatient and outpatient then? So you can be called up to the
Yes.
floor if someone is in the hospital and they first start having.
Exactly.
Okay.
And the speech language pathologist often is in those settings, inpatient, rehabilitation, outpatient.
Oh, so you work like with acute rehab when they're up on the floor, the stroke patients.
Exactly.
Okay.
You've been
I've
around the block
I've
here.
been, yeah, a couple of times now.
Yeah. And then, of course, you know, this is all for adults and pediatrics. So we have a very wide net. So that's another piece of it, swallowing, communication. And then lastly, I wanted to bring up something that I think people would understand, but maybe not think about, is cognition or thinking and memory. Because what do we use to think and remember? Language.
Right. Okay.
Right?
Yes.
It's crucial.
Yeah.
Right? So the speech language pathologist oftentimes is part of that team that helps to help the patient, one, identify if there are changes in thinking or memory from stroke or brain injury, or sometimes they have been sick for a while and so they're just not, you know, as strong.
Maybe in a coma or things like that will affect?
It might be emerging from coma,
Okay.
sure.
Okay.
And then we work with the team to help to figure out how can we help that person support their memory or support their thinking, and then also rehabilitate that.
So how do you do that?
Well, depending on the level of that person's impairment, so someone at a coma, we're probably introducing stimulation to them to get them to respond consistently to a stimuli. Because when people are in comas, we think that they can hear us, we think that they are at some level aware, but they're not able to show you that. And so we're working with them to try to stimulate in a methodical way so that we know when they start behaving or showing us something that might be a reaction to stimuli.
Okay.
Versus someone who is maybe a mild brain injury where they hit their head, they lost consciousness maybe for a minute, and they were hospitalized, they had bleeding on their brain, but they're talking, they're walking, but maybe they don't remember new information, or they're
like
having trouble.
short-term memory
Exactly.
loss kind of thing? Okay.
Yeah. So we would work with them to support their memory, to find out where they're forgetting things and how can they organize a system so that they are actively, just like, I don't know about you, but I use a smartphone.
Right, right.
So I have a calendar and I have a planner and I have a to-do list. And a lot of times, you know, people with brain injury, they can't organize themselves. And so even if they could remember, they're not storing the information to help them help themselves. So a lot of times we will put together a plan, and it's always about what that person's needs are.
Okay.
So if they work in construction, or they're a nurse, or they're a cleaner, it really depends on, or a house mother or father, it really depends on what their needs are. And then not everybody likes smartphones. Some people like the good old planners, paper and pencil.
Right.
It's what works for them and what they're willing to use to help support themselves.
So you're basically helping them choose the tools that are going to help them remember.
Beautifully put.
Right?
Yes, that's perfect. Yeah,
Okay.
that's
Okay.
it. Yeah.
Wow, I had no idea. See, and there's a whole bunch more questions I have.
I figured you had more.
Okay. Well, we're going to take a real quick break, and when we come back, then we'll talk about those other questions.
Okay.
Stick around. We'll be back right after these messages with a lot more information. Welcome back to Your Health Matters. My guest today, Melanie, is a speech language pathologist. I got it right this time, right? Yes. We've been learning a lot, and I tell people all the time, I learn something new every time I do this show. Someday I'm going to be really smart, but
I think you already are.
Thank you. We have talked quite a bit about the different aspects of what speech language pathology covers, and I have to admit, I had no idea. I always just thought it was helping people maybe with a speech impediment, but now we talked about the swallowing, and you mentioned something about voice. What is that?
Yes, so we talked about communication, and I said, you know, we help people with their speech. So speech is, we use our articulators, our mouth, our lips, our tongue, and if you have a stroke, you may have weakness in those articulators, or your sensation may not be as it was before.
So like numbing kind of maybe?
Exactly.
Okay.
So that they may not move the way they did before, and oftentimes then people don't sound clear, and we call that dysarthria, or a change of that muscle movement for speech. So we help people learn techniques to articulate and to improve that strength in the muscle movement to then increase their speech.
So like you give them exercises to practice?
So speaking exercises as well as movement exercises.
Okay.
And then another way of speaking, another aspect of speaking rather, is using our voice. So if we have had something happen to our larynx, or sometimes the vocal cords, which are the parts of the larynx that move, that when air flows over it, we have sound.
And we kind of do that unconsciously,
correct,
naturally. So then if it's not working right, so you help them be more aware then of
exactly. We try to figure out why. We work with the otolaryngologist very closely to make sure that, one, the larynx is healthy, or what the real physiologic issue is, and then we try to address why that voice has changed. Sometimes it can be, again, stroke or a neurologic injury where the vocal cord isn't moving the way that it should. It's paralyzed or paresed. Sometimes it's people with head and neck cancer where they've had chemotherapy or radiation that changes the actual movement. Sometimes we have folks that have a lot of muscle tension. And so just like any other tension in our body, if there's too much, you can have a change and you'll hear that their voices sound different.
Okay.
And so for some folks, if their voice is really important to their job, that can be a detriment.
Sure.
So yes, we would work on that aspect of their voicing for their communication.
So there's all these different exercises that you can give them in all of these different areas. I'm assuming the swallowing involves different exercises, the communication and stuff. So again, we kind of go back to what we talked about at the beginning of the show, how important that relationship is that you have, because it's not just a one-time show up, here's a Band-Aid, you're all better. No, there's a relationship, and it's a long-term process, obviously, to get someone from where they need your help to where they graduate.
Right.
Right?
That's right. And that's a really good point, because we see people along the continuum of their illness. So sometimes we see them right after something has happened.
It's like you're in the inpatient, like we talked about. Okay.
Sometimes we see people who maybe they didn't know that a speech pathologist could help them, and so they've been dealing with this for a long time.
Okay.
Sometimes we have chronic conditions where there are progressive diseases. I think of multiple sclerosis as one. Lou Gehrig's disease is another, where these people may have different changes along the course of their disease.
Right.
So we may see them and have intervention at different points through that. But along that, you're exactly right. We want that person to know that I am working for them, that I am taking all the knowledge that I have, and I get into the books and review the literature on a regular basis, because we are finding out more and more with science
all the time. Right.
And I'm trying to give them feedback about their own performance so that they can regulate their own performance. But I'm on their side.
Right.
So a lot of times
like
I
their
say,
coach or cheerleader.
Exactly. I say, I'm team such and such.
Yeah, very good.
And sometimes I say to them, I know you feel like I'm picking on you, and that's part of my job.
Tough love.
Yeah, but the only way you can get better at something is if you know that something isn't quite right. Or you need to change a behavior.
Yeah. So I'm assuming that you need a physician referral to get speech pathology assistance.
Yes.
Right?
Yes.
Because you're talking about you'd see them inpatient sometimes as well.
Yes.
So someone would, if their physician or that they've identified they have a need, they'd go to their primary care physician, something like that, and they would get a referral from that doctor.
Exactly.
Okay.
Right.
And if someone has questions, though, they could call the main hospital number, 757-2101, and just ask for speech language pathology, right?
Yes.
Okay. And they'll get them over. Now, is your office in the Delhi Webb Wellness Center with the other?
Yes. Since my primary assignment is outpatient adult therapy, I'm in the Wellness Center.
Okay.
And so we can get that number for people if they want to call, and I will try to answer as best I can questions you might have.
And we just kind of brushed over real quick pediatrics. So you work with children too, or do we have a special areas?
We do. I have some experience with children, more of the older children. But we do have a pediatric speech language pathologist that is permanent and here now at Kingman. So I'm hoping that she will also have that opportunity to come and speak to you and speak to folks, because I think that she will have a lot of good information as well.
For the kids too. Well, it is really important, and like you're saying, in communication there's so much that we take for granted, our breathing, and like you talked about the larynx and the vocal cords, and we just automatically, you know, we open our mouth and it comes out. We don't think about what makes it happen.
That's right.
And when something happens that stops that automatic process, it can be very frightening, I would think, and a whole relearning curve that you have to go through. And we're so blessed to have you here now. I'm just so thrilled that we don't have those travelers, because I mean they fill an important role when we have a gap in time, when we don't have a permanent person. But it's so great to have someone here now.
Well, thank you.
That'll build that relationship with the patients.
I think that is what I'm looking forward to. And so far, I have been just amazed by the wealth of knowledge and the wealth of experience here at Kingman. And so I think that for this community of this size, that Kingman is a real gem.
Right, yeah. So we're pretty special. I tell people that all the time.
I feel fortunate to be part of it. And I wanted to say, you know, with the relationship and communication, I think that most of us relate to physical things, and no offense to my physical therapy colleagues. But when communication is impaired, we lose that closeness with each other, because that's what we use to talk about how we feel and to talk about what's going on. And when something disrupts that, whether it's our thinking, whether it's our voice, whether it's our speech, we are distant and we don't have that. And so I think it is really hard. I had laryngitis this year, and I went to the symphony, and people ignored me. And I was so sad. And I said to my husband, I am just so down. I felt so down. And I thought, I wonder how my clients sometimes feel. Maybe I had a little inkling of that.
Yeah.
So.
Well, and it's frustrating too to not be able to communicate what, like you said, what you're thinking or feeling, or what hurts, what doesn't hurt. I mean, you think about for a baby who hasn't yet learned, and all they know is they hurt, and so they cry and stomp their feet, whatever. And as adults, we are kind of looked down on when we do that. Especially stomping feet part.
I guess that doesn't go over very well.
But you're trying to get someone's attention, babe. No, listen to me.
But I truly, you know, unfortunately, we don't understand that until we experience some of that, or we see our families go through that. But I love what I do, and I love helping people.
That's great.
And I think, you know, seeing people who want help, that's the first step. So.
Well, and I think you're going to find, being in Kingman, it's the perfect size community. You know, it's not quite as bad as like the little town of 1,000 people where everybody knows if you sneeze, but it is small enough that we develop friendships and you run into each other. You're going to run into people at the theater or at Walmart or at Safeway. And I always love sharing the story of my granddaughter when we first moved here, when she first moved here. My husband and I had been here for a while, and she first moved here. And she and I were out shopping one day, and she says, "Grams, you're famous." And I said, "What?" Well, this is long before my TV show, right? And I said, "Why do you say that?" And she goes, "Because everywhere we go, people know you." And I said, "Well, darling, that's because we live in Kingman and everybody knows each other. So you're going to find that too." Okay, so we're so blessed to have you here, Melanie. I'm so glad you're here.
Well, thank you.
I'm looking forward to getting to know you better too. So thank you for being with us today. Stay tuned for next week. I'll have another great guest for you then.